Conclusion. Nothing is more frustrating to me than seeing people struggle with unresolved visual problems. They've tried many different approaches, seen many different professionals, and continue to suffer. What can I say to these people? How can I ask them to trust what I'm talking about might be different and might actually help? Other times, the naysayers are medical professionals, family doctors, ophthalmologists, or even other optometrists. For some of these people, it's nothing more than a squabble over territory. For many more, though, it is a lack of knowledge. Medical schools, and many optometry schools, teach a model of vision that makes it seem passive. Vision just happens to you. So these people are not only not educated about vision therapy, they are implicitly educated against it. In the end, they are reluctant to offer help with something that they don't believe they can treat, or don't know how to treat, or don't even realize needs to be treated. They don't even know to be interested. Some of that is just old-fashioned pigheadedness. Lots of docs believe that if they didn't learn it in school, it can't be true. But competent doctors understand that medicine evolves. I often hear skepticism from insurers as well. They say they don't want to pay for something that they don't know anything about. Ironically, of course, they often end up paying for all sorts of other things that can't work before a person's vision is set right. Physiotherapy, psychological therapy, job search training, all sorts of programs depend on a functioning visual system if they're going to work. So in the end, the entrenched beliefs of insurers not only hurt patients, they also hurt the insurer's own bottom line. It's the same story with school systems, which happily pay for reading recovery, even in cases when it's doomed to fail, because it hasn't taken into account the actual visual skills a child requires in order to read, but they won't pay to fix or even test the eyes and brains that are struggling. To be fair, I started out as a skeptic too. I got all the way through optometry school convinced that vision therapy wasn't something worth doing. Early on in my career, I even told a patient who was inquiring about vision therapy that it was quackery, that she shouldn't waste her money. Like everyone else, I had just accepted what I'd been taught. What turned me around was a combination of things. One was meeting someone whose life had been completely changed by it. Another was the advice and mentoring I got from some awesome vision therapy doctors, and the training I got from the various bodies that support the field. Yet another was digging a little more deeply into the science behind it. And last, and maybe the most compelling, was watching vision therapy transform the lives in my own clinic. I remember when I first heard about vision therapy. It was during a university lecture given by Dr. Patrick Quaid. He casually mentioned convergence disorders and their treatment. Later, after I was done optometry school, I shadowed him at his clinic for a few weeks. It was there I encountered the patient who'd blamed himself for not liking to read, when in fact he had a lifelong vision disorder. About a year later, I decided I wanted to know more, so I attended courses given by Dr. Paul Harris and Dr. Robin Lewis. They were describing vision as a dynamic process, not something static, and that model of vision piqued my interest. What I learned was that much of a person's willingness to consider vision therapy is a function of their beliefs about how vision works. In a passive, acuity-only model, vision therapy can't possibly be effective. But I no longer thought about vision that way, so I began to change my views about vision therapy too. I started to read up on specific types of vision problems. The underlying neurology made sense to me. As we develop from babies into children and into adults, we use our experience of the physical world to fine-tune our sensory systems, including vision, the most important of them all. The experience of reaching out and successfully grasping a flower, for instance, helps a young brain calibrate depth and space. Walking forward, spinning around, bending over, they all teach the brain, day by day, how the eyes need to interface with the natural world. It's not a simple process, however, and not based entirely on inherited default programs. That's why sometimes our brains can get things wrong, and tiny errors, where vision is concerned, can amount to life-changing limitations. Not being able to instruct your eyes to accurately track a moving object can mean a life on the sidelines. Not being able to detect where objects are in front of you can mean serious injury. Not being able to move your eyes in an orderly way through the symbols of our language might condemn you to illiteracy. The sad thing is that these are fairly common problems. After conditions like short-sightedness, the most common vision problem in the general population are vergence disorders. About 7% of adults and children, for instance, have convergence insufficiency, which means that they can't make their eyes work together properly at a close range. Over half of patients seeking the help of an eye doctor have these problems. Some of the issues can be fixed through innovative lenses. Much of the theory behind that field, which I call ergoptics, is based on physics and optics. There's no magic, just science, and a lot of tinkering. Most of the troubleshooting I do is just working with theories of light, how light bends, and how a person perceives and uses the eyes to experience the world. Other kinds of problems I learned through my reading, training, mentoring, and practicing can be rectified through vision therapy. Changing the interplay between the brain and eyes through carefully designed exercises with clear feedback is backed up by what we know from neurology. It made sense to me. Best of all, it works. When 12 weeks of real vision therapy was compared to either sham vision therapy, which acted as a placebo, or pencil push-ups, a set of exercises that involve focusing on the sharpened tip of a pencil as you change its distance from your eyes, only vision therapy produced improvement. And some of the kids in the vision therapy group who'd started out not being able to get their eyes to work effectively together ended up, even after just that short time, cured of their problem. What was excellent about this particular research, known as the CITT study, is that it assigned people to different treatments so that their own choice had nothing to do with the outcome. It also compared real vision therapy with something that felt like, but was not, real vision therapy. That made it possible to conclude that the improvement wasn't somehow due to the mere attention of a doctor or therapist, or the commitment of all that time, or the simple belief or hope that something would work, or the random moving around of the eyes. It was the vision therapy itself that made the difference. When I first started out, I figured I'd run a small clinic with just one assistant. That sounded pretty good to me. But it wasn't long before I came face to face with the scale of what was out there. Children who couldn't read, people who'd been in accidents and who now couldn't go out in daylight, people who were so dizzy they couldn't walk in a straight line. Almost all of them were abandoned by mainstream medicine, often blamed for their own symptoms. I felt for these people. It was lucky for me that when I started out in vision therapy, I was young, unattached with no kids and no mortgage. I didn't need a ton of money. I had lots of time. I did a lot of training, traveling all over North America, and was really able to try things out and fine-tune them. It allowed me to develop the basis for the programs I have now, and I'm still working on them. I suppose I always will be. I owe a lot to the educational bodies that got me started down this path. The OEP gave me deep introduction to vision therapy. Both the College of Optometrists in Vision Development and the Canadian Optometrists in Vision Therapy and Rehab kept advancing my understanding and my education by providing awesome courses and resources. Dr. Paul Harris ended up mentoring me through my lengthy COVD fellowship. Like anyone, I had to learn a lot along the way. I discovered what worked and what didn't. I let the underlying neurology guide me. I approached vision therapy from an engineering perspective. At each point, I stopped and asked myself, does this make sense, logically, given what we know? Even now, at our clinic, we continually test and retest, and then apply what we learn. We don't just blindly accept what has been proposed. We keep questioning. My vision therapists are a big part of that. They come from backgrounds like kinesiology, teaching, and psychology. Every week, we take an hour or two to discuss how things are going and how they could be improved. Much of the learning process now comes through them and through our shared experiences in the clinic. Obviously, it would be great if we had larger, longer-term studies. Lots of them. I'm totally in favor of further scientific studies. Bring on the double-blind, placebo-controlled prospective studies. Studies in school children, studies in older people, studies confirming exactly what's best after concussion. But to date, there could be more of them. Complex long-term studies are very expensive, time-consuming, and in some cases ethically challenging to carry out. A study on children and reading, for instance, might require children in the control group to undergo a year of sham treatment, which could be very harmful in the long term for those kids. So for now, it's up to people on the ground, in the clinic, like me, to make careful observations and judgments. Academic opinions are all fine and well, but in vision therapy, the real progress is still in the trenches. Vision therapy doctors aren't formulating their opinions simply on what they read, but also on what they see every day in the clinic in their patients. We are at a point in time when vision therapy has not yet become truly mainstream. Unlike speech therapy or physiotherapy, doctors don't regularly prescribe it. Insurers don't routinely cover it. Public health bodies don't endorse it or provide it. That will change, but not quickly enough for the kids and head injury patients of today. There are several reasons we are not there yet, but one of the most important comes down to how we are taught to think about vision. We optometrists are taught a static model of vision that doesn't pay much attention to neurology. Similarly, ophthalmologists, medical doctors who treat eyes, are mostly taught to be concerned with the physical health of the eye and its socket. Many of them learn that if the eyes are straight and in apparent alignment, then they are fine. For reasons I can't quite understand, none of us are encouraged to think about the function of the visual system as a whole, eyes plus brain. It's like giving an accelerator pedal a good old inspection and declaring the vehicle fine, even if it can't accelerate over 40. What about the engine, people? It doesn't make sense. You'd expect more from your mechanic. You'd expect him to look under the hood and to know how the pedals work with the engine as an integrated system, and you'd expect him to ask intelligent questions and to probe. At the very least, you'd expect him to admit it if he didn't know what was wrong. Too often, though, we eye doctors assume that if we don't know about something, it must not matter. It's how we were taught. Sure, vision therapy was mentioned in optometry school, but it was only in passing. It wasn't something we focused on at all, something to be taken seriously. It was never made to sound like an avenue we young optometrists ought to consider pursuing, so a lot of optometrists didn't pursue it. The ones who do are sort of left on their own. This raises another issue, consistency. The words vision therapy can mean different things to different practitioners. For some, it is entirely computer-based. For others, it's a series of simple exercises like pencil push-ups. For others like me, it's an intense program that can last months that recalibrates how the eyes and brain work together. We need consensus on what treatment actually involves. Practitioners need to know what they should be offering, and the public deserves to know what they're signing up for. What I really hope to see in the coming years is more dialogue and collaboration on this. I'd like to see a group of optometrists come together to set standards and guidelines for the field. That's not to say we should settle or stagnate, not at all. We need to keep improvising and testing and growing the field. There will be variability for sure, because there are different schools of thought. One of the beauties of variability is that it keeps the profession moving forward. But we need to start moving forward in unison, not in opposition. We need to optimize vision therapy as a team, as a profession. Only then will we get vision therapy to the places it desperately needs to be. 3 particular areas stand out for me. Elementary schools. You've heard me rattle on about this, but I firmly believe we need a comprehensive program in all our elementary schools. We need to provide very basic vision therapy to all kids, the way we provide iodine in our salt and vitamin D in our milk. Sure, some kids won't need it, but they won't be harmed. Other kids will be rescued by it, without even knowing. And the most at-risk kids will stand out as needing special help, and they will get that help. And, with luck, they will be spared the years of agony and stigma and lost learning that so many of my patients and their families have suffered through. It's hard to understand why healthy visual functioning is not part of what we regularly screen for in the early years of school. There's no excuse for not making sure kids can function visually to a basic level before we undertake the challenge of teaching them to read. It's just basic school readiness. I just don't get that. Let's turn it around. Post-head injury treatment. It's essential that vision therapy is recognized as an integral part of treatment following head injury and concussion. Medical professionals need to recognize this. Insurers need to recognize this. Schools and sports teams need to recognize this. Employers need to recognize this. Many people, after head injury, cannot benefit from the other treatments on offer until they get their vision issues looked after. The light sensitivity, dizziness, nausea, headaches, inability to look at faces, inability to walk. These symptoms need to be dealt with before people can be expected to move forward in their recovery. And trained optometrists should be providing the treatment. This is just such a no-brainer that I feel silly having to emphasize it here. Headache care. It may seem less urgent than the aftermath of concussion or not being able to read, but in terms of the number of people affected and the numbers of hours of work or school lost, headaches are a huge burden on our society. So many of them are caused by visual systems that are not coping with the demands placed on them. For some, it is the long hours in front of a computer screen. For others, it is the way they process light. So long as the reason for the headaches is the visual system, and it very often is, vision therapy and ergoptics can help. Yet people with headaches are almost never offered vision therapy in special lenses. Rather, they are prescribed pharmaceuticals, which only mask the symptoms instead of eradicating them. Now, everyone is doing the best they can with the information they have. I get that, but we have to improve the information they're working with. There are people who need our help. True confession. My sister had vision issues as a kid. Growing up, she had trouble with how her eyes tracked and how they worked together, and she struggled with reading. She was often agitated and was super frustrated with school. Because no one could find anything wrong, she went through all the regular visual testing was cleared. We all just assumed she was lazy and needed to try harder. Little did we know that the root of the problem was the faulty visual system. She was effectively working with Windows 98 while everyone else was on a new Mac. Even though I've since treated her, and she now has her MBA, I can't tell you, looking back, how bad I feel about this. I also feel regret about that patient I steered away from vision therapy all those years ago. I've lost touch with her, but who knows how her life might have been different had she asked an optometrist less ignorant than I was then, who could have given her the advice she needed and deserved. There are millions of patients just like her, all over North America, still being told not to pursue vision therapy. Just knowing this is like a weight on me. Then there are all the patients, or their doctors, who contact me asking for the name of someone in their own community who can offer good quality vision therapy. Often I can't think of who to recommend. So few people actually do vision therapy, and even when you find one, the approaches can be so very different. We need to change the culture at optometry school so that this is a real and supported option for young optometrists. We need to build the country's network of doctors so that when patients come forward, they have someone to help them. I'm confident all of this will change. Kids like my sister will be identified and treated early. Optometrists and medical doctors will learn in school what vision therapy is, why it works, and how to do it. Many more optometrists will choose this path. That day is coming. I sincerely hope that this book and my commitment to vision therapy are helping, in whatever small way, to speed it along. Acknowledgements. Many have helped me in making vision therapy and neurovisual performance my life mission. I'd like to start by thanking some of the leaders in the field. Dr. Patrick Quaid was the first to introduce me to the idea of vision therapy, and he encouraged me to think of it as a genuine possibility. I will always be indebted to him. Thanks also to Drs. Paul Harris and Robin Lewis, who have really challenged me and nurtured my curiosity. The OEP, NORA, COVTNR, COVD have provided amazing support and resources, and their members have been treasured colleagues. Our profession is incredibly lucky to have multiple educational bodies with varied approaches. I can't say enough good things about the excellent book, Vision Rehabilitation, by Drs. Penelope Suter and Lisa Harvey. I'm so grateful that the authors put this together. It's one of the best vision resources out there. I keep one copy at the office and one copy at home. To the physiotherapists, especially Bernard Tonks, who teaches some of the best courses on vestibular rehabilitation, occupational therapists, lawyers, doctors, and other professionals who have been supportive, thank you. I realize that it is not always easy. To the whole Visual Process charity team, thank you for believing in the mission and giving your hours and your expertise. I'm honored every time we get together. Clyde, Brian, Joseph, Agnes, and Arthur, the Brooklyn Clinic would not be possible without you. It truly takes a wonderful team, and I'm humbled to work with all of you. To my amazing team of vision therapists, you show empathy, kindness, and skill every day in working with our patients. I have learned so much from you. To my optical team, your dedication to ensuring the prescriptions are 100% accurate and our patients are treated like family is a key part of the results we achieve together. My office manager extraordinaires, you are the glue that holds the entire clinic together and keep us all on track. Our amazing front desk team are scheduling wizards, and I am forever grateful. A special thank you to my patients for allowing the opportunity to share in your journey. I'm so honored to be able to play this role in your lives. The hardships you have faced inspire me to change the system, and the success you experience fills me with purpose. I look over your cards and letters all the time. Many thanks to my parents who helped me develop the compass that allows me to stay the course in the face of adversity. They have encouraged me to fight to help others. To my sister Carolyn, I had no idea, back when you were a kid, that you had these visual issues. Nobody did, and I'm sorry we assumed you weren't just trying. You are the reason why I cannot let another child struggle needlessly. And finally, thank you to my beautiful wife, Morgan, and my two boys, Benny and Bo, who listen to me talk vision therapy in my sleep, remind me to take downtime, and help to ground me when I get frustrated with our current system. I couldn't ask for better people to be in my life.